So the topic is digital pathology. And so how many people have any medical background at all? Raise of hands. Okay, that's 6. That's better than most places. So pathology is you have a tissue sample from your body, you slice it, you gross it, you stain it, you put it on a glass slide, and you put it in a microscope, you see something, and you make a diagnosis or staging or whatever. That's all pathology. Now you do it digitally, that's digital pathology. So sounds like, if you take the normal process, digitize it, something will happen. It'll be more efficient, you could do more in less time, the standard play that comes with automating a process. But I would make a premise that what is about to happen in pathology through digitization is about to cause a major disruptive change. It's about to cause a major disruptive change in healthcare, and that's what I would like to walk you through. So when I said digital pathology and disruption, Saurav said to me, you're only allowed to talk about 2 things. So I said, fine, I commit to speak to only 2 topics. Now, this is my sorry attempt to try and meet up to that commitment. Okay, so my topic number before 1 is to simply point out that whole innovation that digital pathology is going to lead in healthcare, there is a need to step back and look at this issue somewhat differently. So I'm going to take this word somewhat differently rather seriously and walk you through some pictures by Picasso to make that point. So in this classic world of looking, as in looking through a microscope, it was easy to see what was going on. Reality was recognizable, and even though sometimes fuzzy, the picture was understandable. But then things started to look funny. So if I rewind the tape to some 20 years ago, the first biomarkers, you can imagine there was some complexity that had to be dealt with. Things became harder to recognize, disjointed, but you could still tell what was going on. Harder, and harder, and finally it became impossible to see what was going on. So this is happening not only in the pictures alone, it's also happening to the business model of delivery of healthcare. Getting harder and harder to see what is going on by looking at things the conventional way. That's the problem, looking at things the conventional way. So if I lay those pictures down, the first set of pictures, the second set of pictures, the third set, there's quite a bit of similarity. So if I go forward, this group is identical to this group, only done 20 years apart, and this is identical to this, done only 20 years apart, for instance. So our onus is to figure out the pattern, or the trend, if you will, that lies hidden underneath this chaos, to see through Picasso's outer shell, to see the Velázquez that lies beneath. So if I rewind and go forward, that's Picasso, that's Velázquez. This is the Las Meninas, the picture at the famous painting at Prato in Madrid, if you've been there. So if I go back a couple times, so maybe you want to focus on, say, the girl or the man in the doorway or the little dog there. So there is some virtue at the point of inflection to just step back and see, is there something fundamental that is about to happen? So my bold conjecture is nothing has changed in healthcare in the last 2,000 years. Nothing, not one bit. Yes, there is new technology. Yes, you can do some things faster. Yes, you can save more lives. Yes, there is technologies that can allow a quality delivery, as Chuck is going to speak to later on. But fundamentally, the premise is the same. You're well, you get sick or you get hurt, you go to some kind of a healer, and you get better. That's what's been going on for 2,000 years. You're good, you're well, you either get hurt or you get sick, you go to some kind of a healer, that healer checks you out, diagnoses, stages, and somehow heals you. And you get better and you go home. And now there are some slight variations along the way. A third-party payer system means somebody else pays for all this crap. So those are all minor deviations. Fundamentally, nothing has changed. But it is about to. We're about to enter a new era where the cost curve, if I draw it from your perspective, where it says early detection, prevention, adverse event, and then chronic care, that cost curve can be fundamentally shifted to the left, your left, as in my right, but your left. It can be. And that's what is personalization going to give us.